COVID-19 cases are still high in Michigan. Like those working in hospitals, first responders are overwhelmed, but they're staying focused. The coronavirus pandemic caused a lot of fear and uncertainty for everyone, even first responders.
To be honest, I think for a lot of us, it was scary because it was a new virus, that nobody had heard of, and nobody had really dealt with it.
At the beginning of the pandemic, Jackson Community Ambulance actually saw a huge decline in people calling 911.
It kind of decreased our workload. People were afraid to call 911. Nobody wanted to be exposed to it. And sadly enough, the people that really needed 911 did not call 911, so we've seen a rise in at-home deaths.
But as time went on and vaccinations started to roll out,
I think that for a second there, everybody thought it was kind of non-existent anymore.
They say their call volume crept back up.
The increase of 911's gone up quite a bit. Everybody's calling for COVID symptoms, and we can kind of resolve a lot of it.
It's been exhausting for them as they see cycles repeat, and their workload is up. On top of responding to medical calls, they have to decontaminate their ambulances and equipment constantly to keep everyone safe. The documentation that they have to complete has also increased, and they are dealing with an EMS staffing shortage across the country.
It's been a problem lately, being staffed fully, so that's making it super hard on our crews, especially when we're running back-to-back calls and up for 24 hours at a time. Being down 2 or 3 cars a shift is definitely a high impact on us.
Although they are feeling overwhelmed, they say the calls aren't going to go away, and it's their duty to help people.
I think everybody's become a little more comfortable being uncomfortable. Does that make sense? And again, it's not going to change the way that we go out there and we take care of people.
So here's how you can help them help you. Try using other resources if it's not a life or death emergency. If you think you may have been exposed to COVID, try a drive-through testing site or contact your primary doctor.
There are so many resources out there that I think are being underutilized, and people are just flocking to the hospital to get those answers, which unfortunately, the hospital is where they keep the sick people. If it could potentially significantly alter your life or your quality of life or end your life within 24 hours, that's 911.
You should also wear your mask, wash your hands, and stay home if you are sick in order to combat this surge. Reporting in your Jackson neighborhood, I'm TIANNA Jenkins.